Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
So you're looking at a chart for one of your patients. Let's call him Mr. Smith. He hasn't been in the practice for 3 years. He was a nice person, never was a problem, paid his bills and showed up on time. But 2.5 years ago, he missed his last cleaning appointment and you have not seen him since. Your office may have called him once or twice, but he's never called back. So with it being 3 years, do you purge or deactivate this chart, never to contact him again and call it a day? I mean, he's no longer active, right? Back in episode 11, I discussed how much it costs to get a new patient, along with how most offices have retention issues that cost them 50% or more of our patient base. A lot of Mr. Smiths. So for this week's episode of Dental Business RX, I want to drill down on this subject a lot. Specifically, I want to talk about when should you deactivate a chart, as well as how to keep your patient base active and what to do about those patients who have become inactive. My name is Jeff Bloomberg, and I'm your host. And to start the episode, I just want to address, and I've said this before, what I consider to be the two biggest managerial problems in the dental industry. The first is case acceptance, and we talked about that in episode 1, and you'll hear some future episodes coming up about it. And the other is your hygiene department. The hygiene department should be growing continuously. It should be an area of recurrent income. It's also a method to keep your patients coming back so you can continue to maintain their health. But it's not uncommon to see a dentist who's been practicing for 10 years that's still struggling to fill 3 days of hygiene when they should have 8 to 10. It's just a problem. So if you look at how this is born, it's born primarily due to poor follow-up, as well as this concept of making people, inactive. I'm doing quotation fingers as I say that. So we get to this concept of an active patient. Generally, we consider an active patient someone who's been in the practice within the last 2 years. Now, there are no studies that I'm aware of. There's no white paper on this. There's nothing that said, patients who have been in within a 2-year period versus 3 years or a year are more apt to schedule for their next appointment. It's a complete arbitrary number. And I don't know where it came from originally. I've heard this term for the last, I've been in the industry since the early 90s. It's been around since then. This, 2 years as an active patient. I'm suspecting it was born, as a result of buying and selling practices, practice brokerages, with the idea that, if you buy a practice, you're going to look at how many unique people have been there in the last 2 years, and you think you have a better chance of getting those people back than somebody who hasn't been there for 3 or 4. But if you look at the average practice that's been around for any length of time, they'll have, however many active patients they have, 1,500, 2,000, 3,000, and then they'll have, that amount or more, maybe double, triple, quote unquote, inactive patients who haven't been in the last 2 years. So they have active and inactive, and usually inactive outranks active by a lot unless it's a brand new office. So how does this happen? What is the industry standard on this? How has this always worked? Well, let's look at the concept of chart audits. You've probably done them in your practice. I've seen lots of dentists who do this, or office managers rather. You'll do a chart audit where, you grab physical charts in the old days, or you pull up a report in the computer and you look at anybody who hasn't been in the last 2 years and you purge their chart. You might call them. Some offices call them, some don't. Some just purge them. You look at here's Mr. Smith. You called him 3 times. He hasn't called you back. It's been 2 years and 6 months since the last time he was in. Well, he's not planning on coming back, we decide. We always assume the worst in these cases. We have no idea what's going on because we haven't spoken to him. And we're going to purge this chart now. We're going to just, make it inactive, which means he's not going to get called anymore. He's not going to get postcards anymore. He's not going to get mail anymore. In the paper chart days, that chart would go in the basement or in the doctor's basement if there was no space in the office. So that's the office's perspective. Let's look at this from the patient's perspective for a second. So here's Mr. Smith, who hasn't been in 2.5 years. 9 times out of 10, if a year from now Mr. Smith has a toothache, who do you think he's going to call? Well, he's going to call you. So he comes into your practice and you haven't seen him in 3.5 years. And what happens? Wow, Mr. Smith, I haven't seen you in 3.5 years. You'll get the response, really? Has it been that long? Yeah, I've been meaning to call you guys. In his mind, you were always his dentist. That never changed for him. But on your end of the stick, with your staff, you're looking at this, Mr. Smith doesn't want to come back. He probably has gone to another office. You've made all these decisions about somebody you haven't spoken to at all. This is generally what happens. But in Mr. Smith's mind, You were his dentist and always were his dentist. So doesn't that tell you that maybe we shouldn't have made Mr. Smith inactive, maybe try just a bit harder to get them back? And let's say he's not the most compliant patient in the world. Let's say he tends to miss appointments, but he's not a bad person. It's not like somebody's blowing off and just not showing up for several appointments in a row. He misses an appointment once in a while. Well, that's why you have patient education. You know, in a nice way, you can point out to him why it's so important to keep those regular cleaning appointments. You know, you want him to keep his teeth for the rest of his life, because if his mouth, he has good oral health, that's going to contribute to good systemic overall health and quality of life. These are educational points. Make Mr. Smith a better patient instead of just deciding Mr. Smith's a bad patient and we don't want him back. So this is the problem. This is why, we spend all kinds of money getting somebody into the practice, like I talked about in episode 11, and then we spend minimal time and follow up to actually keep them in the practice, which is what I'm going to get into a little bit more in this week's episode. But let's start with, when should you deactivate a chart? Now, I'm going to put a little disclaimer in here. You have to decide how to do this. You have to do what is real to you. I'm just giving you my advice, opinion, things that we've told our clients. But ultimately, you're the one who's going to have to decide, and you're the one who has to be responsible for the consequences. And obviously, even if you do deactivate a patient, there are laws on how long you have to keep records and things like this. And obviously, that's up to you to follow those things. So what we teach our clients here at MGE is there are 4 reasons you would deactivate a chart. So let's go through them and talk about them a little bit. Reason number 1 is obvious. The patient is deceased. There's not much to talk about there. Patient's deceased. They're not coming back. Okay. Let's get on to reason number 2. The doctor, does not want to see this patient again. Now, that may be unexpected for you to hear that from me. You don't want this patient in your practice. So one of the first services an MGE client does is the new patient workshop, how to get more new patients. All right. So then, we have 3 seminars where we go over how to improve case acceptance, where they're called the sales and communication seminars, and they're, seminars A, B, and C. All right. Well, seminar A, we go into the quote unquote problem patient, the patient that you don't want in your practice and what characteristics they have. So I'll go up on stage, and it's funny. If this is someone's first seminar after the new patient workshop, I'll start off with, you just came from the new patient workshop and you learned how to get rid of, or how to get more patients. Here you are on day 1 of your first sales seminar, and I'm telling you how to get rid of them. It's a bit counterintuitive, right? But this is actually a critical part of managing your practice. If you look at tomorrow's schedule, and there's a patient on that schedule that makes you not want to go to work or makes the staff get all stressed out. Oh, this person's coming in. Why are they in your practice? Either you need to have a conversation with this person to set things straight so that they're not causing so much havoc in your business and treating your staff like garbage or stressing you out, or they shouldn't be there. They need to go to another office. That is your right. Now, there are issues if you're going to dismiss a patient. Obviously, if you're in the middle of treatment, that's a whole other thing. But if you're going to dismiss a patient, first off is your right to dismiss a patient you don't want. And there are rules and ways of doing it that can be found in your Dental Practice Act. So and you want to always do it according to the letter of the law. But if you have someone in your practice and you look at it and you go, I just don't want this person here, they should not be there. And you might think, well, that's going to cost me money, right? And the customer is always right, which we know is absolutely wrong. If I come to you and I need a crown and I told you I want a multi-pin amalgam restoration, am I right? No, of course I'm not right. All right, so the customer isn't always right. You got to do what's best for the customer in a lot of cases, especially in dentistry. All right, but how much do you think you're costing the practice by keeping this toxic person in it? We cover this in our seminars, obviously. This is one of the things we talk about. And the percentage of people who fall into this category is a lot smaller than you might think. But the point being is, if you're keeping someone around like this, and they're stressing you out, despite trying to smooth things out, they're still stressing you out. They're stressing your staff out. They're causing problems. How much do you think you're causing the practice by depressing the environment, by making the environment, less upbeat, by keeping this person there? Believe me, this does affect how you handle other patients, because it affects you and it affects your team. So it is your right. If you don't want someone in your practice, you should not have them in your practice. And obviously you want to follow the Dental Practice Act when you would dismiss them. And, my suggestion, if somebody asks me about this, I normally say, before you do anything, call your malpractice carrier, discuss the situation with them, and they'll kind want to put you on the right path, because obviously the malpractice carrier wants to avoid issues and lawsuits and things like this. They're going to give you good advice in that regard. That's been my experience, at least. And and of course, if you're in the middle of treatment with somebody like this, well, then that becomes a little bit more difficult, if not impossible in certain cases. But the bottom line is, you want to be able to spot these types of people before you actually start treating them. These toxic personalities. But that would be a reason to dismiss somebody. We have someone's deceased, and then number 2 would be you don't want them in the practice. All right, number 3 would be the patient doesn't want to come back. Now, I would split these into 2 other categories. So let's say I have a patient, they've come into the office, and they have an upset. Well, obviously, I'm going to do everything I can to smooth that upset out. All right, but let's say no matter what I do, it just will not smooth out. Doctor, I can never trust you again, and whatever. Your staff were so mean to me, and I do everything possible to make this okay within reason. Well, then they're going to leave, right? Or they decide they just don't want to come back. They heard that someone down the street is cheaper, so they're going there. All right. And they tell me they're leaving the practice. All right. Well, number 1, and this is something you should keep in mind in any time you're deactivating a chart, there should be some type of a process by which charts are deactivated, meaning you can't be a new receptionist making reactivation calls and somebody says, I don't want to come back, and then they just make them inactive. It should be an approval process. So whether it's the office manager or the doctor, you actually have to look at these patients who are being made inactive before that happens. This should happen in every scenario, because otherwise you'll end up with a bunch of people. You could have somebody who's just horrible at calling people, and I've seen this. They're horrible at setting appointments, and they call patients. They're very poor at communicating. They upset the patient. The patient says they don't want to come back, and then they just mark them as inactive. All right. So they're losing patients for you, and you don't even know it. So if someone's going to be inactivated, you should know. You should be made aware. You are the OM. There should be a little, like a little routing card that goes with it or something like this, where it has to get approved before they're actually made inactive. So let's say we have this person who's really upset with your practice. You try to smooth it out, or just decides they want to leave because it's cheaper. You look at it. There's nothing you can do to smooth it out. You tried, or the patient just, they heard about those $999 implants, so they're leaving. Well, in that case, fine. They're gone. They're inactive. You'd mark them as inactive. Okay, totally fine. Right? All right. But what about somebody who says, well, look, my employer just switched over to an HMO, so I can't come to the office anymore. It's just a bit of a deal breaker for me. I don't have this kind of money. Okay, well, you're not going to keep them on the recall schedule anymore. And again, this should go through that approval line so you can actually verify it. They should be made aware, like, look, you can still be a patient here in the practice. I just won't accept that fee schedule. I'm not part of that plan. Or they want to go to a preferred provider and you're not it. But they should know they can come to your office. The fact that they have a PPO or an HMO doesn't preclude them from coming to your office. And if they're an HMO patient, they're not going to have any benefits at your office. And a PPO, they're going to be paying a little bit more. They should know this. But you may take them off the active recall schedule if they tell you that they won't be coming back. But I would still keep mailing to them. And I'm going to talk about what mailings I would recommend that you do. You want to keep them in the loop as to what's going on in your office and keep them aware of the fact that you're there. And I say this, if you ever dropped a plan before and seen a patient leave, if you may or may not have, you probably have seen some of those folks come back. That is not uncommon. I've seen that happen a lot. Someone will drop a plan, or a patient switches plans. They can't come to your office anymore. In a lot of cases, not all the time, you'll see some of these folks come back because they didn't just go, they weren't in your office for the money. And then they go to this other office, this HMO office, and they go, I don't want to be here. And I'd rather just pay the little bit extra and enjoy where I'm going for dentistry. So it's not uncommon to get those folks back. So you want to stay in their mind. I wouldn't write them off completely. I'd take them off active recall, but I would keep them on the newsletter list and everything else I'm going to talk about here in a little bit. As a matter of fact, funny thing, one of our clients in Central Florida has her biggest source of new patients is the corporate office across the street. The patients don't like how they're treated there, and they just walk into her office. It's a perfect location. Like, they don't like theirs, they just come to her. So I wouldn't write those folks off and I'll get into this a little bit later. So that's reason 3. What's reason 4? Patient moves. Now, again, this is why I have an approval process. I've seen plenty of times where someone moves and maybe they fly into your area a couple times a year. You're still their dentist and they intend to keep it that way. Part of I'm moving out of town should be, well, are you going to be going to another dentist there, or are you staying with us? Right? Now, if you're in Illinois and they've moved to North Carolina and they tell you, yeah, I'm going to have to find someone there, you might want to help them find somebody that you could refer them to. That's always nice too, right? You transfer the records and the whole 9 yards. And obviously, the patient would be involved in that and sign or request whatever they have to sign. But the point being is, not just because they move, you don't want to get robotic about this. Just because they move doesn't mean that they have to leave. And those are the 4 reasons. Deceased, you don't want to see him again. They don't want to come back to the office with a little bit of a caveat there with HMO plans or managed care, or the patient has moved too far away. Now, you'll notice I didn't have as part of my 4 reasons, the patient hasn't called you back, the patient hasn't been in for 2 or 3 years. That is not a reason to deactivate a chart. So let's take a look at this. Let's say you're the average office and you have 2,000 or 2,500 active patients, and you have 5,000 inactive patients that have been inactivated just due to inactivity, not because they're deceased or moved out of town or whatever. Well, what do you do about those people? And that's what I want to get into a little bit, because that's the average office. You have gobs of patients who are unscheduled. Most softwares, EagleSoft, Dentrix, have a reporting feature where you can pull something up that tells you, out of your entire patient base, who has a next appointment. Whether it's 6 months from now, 3 months from now, but here's the list of patients and who has a next appointment. I would recommend you try this. Jeff Santone talked about this a few weeks ago, but it will usually shock you, because you'll find you have a small amount that have their next appointment, and then you have a ton that don't. So let's talk about, how do we avert having a ton of inactive patients? And if we do have a lot of inactive patients, what to do to get these folks back? Let's start with, how do we keep people active and at least start making overtures toward getting people back? The first thing that you need is somebody responsible for this. You need someone who is in charge of, especially if you have enough charts to reactivate, you need someone who's in charge of reactivation. And I discussed this in a prior episode, but if you do the math on it, if you have 6,000 inactive charts and you look at how much it costs you to get a new patient, and you hire somebody at $40,000 a year and they reactivate, 200-300, let's say they reactivate 100 patients a month. How much would you normally pay for 100 new patients? Probably $25,000 to $30,000 a month. That's a good investment. All right. So something to play with. We can help you with that. If you have questions about it, you just contact us here at MGE. But the first thing you need is someone responsible. It might be somebody who has another job in the office too. It might be the office manager, might be a dental assistant, might be a scheduler, but somebody has to be ultimately responsible for keeping your patient base active. This is who you go to. So the next thing you need after that is a regular means of communication to these folks. Now, a couple things here. One, this may not sound like much, but you need to have some form of a practice newsletter. It should go out quarterly or ideally monthly. People have asked me, should it go out via email or hard mail? I do both personally. Some people still look at snail mail. And, it's just like any other marketing thing. You go off in one direction too heavy, and then it starts to bounce back the other way. We've gone very heavily on the internet marketing line. So then the snail mail line starts to snap back, right? And it becomes more exciting again. And then eventually that'll get overloaded and we go the other way. But the point being is, you want some form of regular communication and mail going to these patients, like regularly going out. Now, as far as what kind of newsletter, I know there are canned newsletters out there, where they insert the picture of you and whatnot. Now, I'm kind of funny this way, and I'm giving you my personal preference here. I would prefer it's something made by you guys. I don't care if it looks like terrible. I find if I get a newsletter from a local organization, it looks like they made it. They didn't pay a bunch of money to have somebody make it for them. It has that sort of homemade look. To me, I find that more attractive. I don't know why. I know it actually came from them, and I'll read it. So it doesn't have to be super fancy. It can be very simple. A little bit of maybe an article on something about maintaining their oral health, how to brush, how this, that, the other, or the link between gum disease and heart disease, whatever. Just some type of information, an informational article from the doctor, might have news in the practice, who you hired, so-and-so just got married or had a baby, something like this, stuff going on in the office, any kind of a specials you want to offer the patient base, referral special or some type of a special on Invisalign, this, that, the other. And you just send that out regularly. Now, this accomplishes 2 things. One, it keeps you in your patients' minds. So you're calling, keep in mind, and we've talked about this in marketing episodes before. You want multiple vectors or directions to come at somebody to stay in their mind. If I see a mailer from you, and then I see you on the internet, and then I see a billboard and I see a TV commercial, you're everywhere as far as I'm concerned. Do you see? And that makes me more apt to respond to your message. So you want to stay in your patients' minds. If you're sending mail out and then you're also calling these patients, you have a better chance of actually getting them to come back. And in many cases, they'll pick up the phone and call you. You might find that you've sent a year of newsletters to somebody who has been inactive, and then they pick up the phone and call you. If anything, I can tell you, if they have a dental problem, unless they have a problem with your office, you're the doctor they're going to be calling. All right? If they're getting regular communication. So that's point 1. Point 2, it also keeps the patients that are currently there from going away. It doesn't do it entirely, but it helps. There's other things too. Obviously, you want to schedule the next appointment and all that stuff, but it's something that helps. It keeps your patient base united. The other thing that it does in the United States with the U.S. Post Office, if you do a forwarding order so that your mail gets forwarded, it lasts for 6 months. After 6 months, it gets returned to sender. So if you send nothing to a patient for over 6 months and they move, you lose their address. Now, yes, with Google these days, we can find things like this, but why do you want to devote time for an employee to start digging up people's addresses, especially if you have a large patient base? A certain percentage of everybody's patient base is moving, even if they're moving within town. So regular mail keeps your address database active and accurate. It's important. So you want regular communication. Now you can add other types of communication to that too. You could have postcards. There can be text campaigns to reactivate, and obviously phone calls, which I'll talk about in a second. You can have some type of a special offer to patients who haven't been in for a while, $50 off their next appointment or something, which might induce them to come back. But the idea, we're barraging people, not in an annoying way or a ridiculous way, but we're hitting people with regular, steady communication to A, keep them active, and B, get them back if they are inactive. Which then gets us to the phones. Now, I have a download for you. It's on the episode webpage. It's our reactivation program. Now, reactivation program is a series of letters and a whole step-by-step method of calls and whatnot to make your patient base active again. And if you can have somebody doing this if you have a small amount of inactive patients with those folks, or you might have somebody full time if you have a lot of inactive patients. I've seen 5,000, 10,000 inactive patients that you could be working this in order to get these folks back. And what it does is it sets up a system of regular communication, mail, phone calls, etc., which you can add texts and things like that to that as well, to be able to get these folks back into the office and to keep them active. All right. And again, it's very important. If you have, the one thing you don't want to do is this, is if you've got 3, 4, 5,000 inactive charts, you don't want to just tell a dental assistant to spend an hour a day doing that, or an hour a week, or tell your scheduler to, increase their efforts to get these folks back. How many man hours would it actually take to schedule 5,000 people? You may need to hire somebody. It's something to think about, but that is really based on what's going on in your particular situation. And one thing I'd warn you about as well, especially when you put somebody on the phone, which, by the way, if you have somebody who is fairly upbeat and, like a social type person who likes talking to people, and let's say it's a new hire. We've talked about in prior episodes not putting a new hire immediately onto answering your phones because you're spending all this money on marketing and they may be blowing new patient phone calls. This is a great position for a starter position because it's very easy to teach somebody how to schedule a hygiene appointment. Here's Mr. Smith. He hasn't been in for 3 years. Well, that's a pretty simple appointment to schedule. You're scheduling a new initial oral exam, right? And you're scheduling, probably full mouth x-rays. There's very basic rules you could give this person where they could be scheduling these folks. It's not something where they're trying to schedule, 6 crowns and 2 implant preps, where you need to know how a schedule works. This is a very easy, good starter job, and it's easy to train, right? But one thing they'll run into when they're making phone calls is they will run into a small percentage of people that they talk to who are not very nice. And that happens. You have people in your patient base that are not nice people. It's a very small percentage. But I could say that about any business in the world for that matter. All right. You have a small percentage of people who are just not nice people. What you don't want to do is when you run into somebody like that, especially let's say they're calling someone and the patient says, why are you people calling me? I got one of your letters last week and this is terrible. And they get the idea that everybody is like that. This happens. It's very common. And just as humans, we tend to focus on the negative. If you had 20 patients come into your practice and one was nasty and 19 were any combination of nice or whatever or acceptable, we're going to always focus on that one nasty person. That's the person we're thinking about and talking about, right? So you want to make sure that they realize and can focus on the good. They're going to get the occasional phone call and they just need to write it up and give it to the office manager where the person's just not nice. And then you can make the decision what you want to do with that patient. It might be somebody you call because you know them. Maybe they're having a bad day, or it might be somebody that you just don't want in the practice, right? But it's something to warn somebody about when they get on the phone. The vast majority of people are going to be nice. right? But again, we tend to generalize and remember the bad. So it's something to worry about, especially when you're having somebody making this many phone calls, if you're putting somebody on the phone full time to make reactivation calls. All right, good. So that pretty much hits on the reasons why you'd reactivate, how to keep your base active. We're going to get into in future episodes a little bit more about building the hygiene department and the things that you want to do. The one thing I would tell you just as a little bit of a preview is you need to make coming regularly for cleanings a bit of a bigger deal. If I go into the average dental practice in the United States, I'll see lots of signs for Invisalign or bleaching or, etc. But I never see a sign for, make sure you're here for your checkup every 6 months or more frequently if I'm supposed to be. You never see any type of promotion on that. You need to make it a big deal. And if you make it a big deal, it becomes a bigger deal for the patient. All right. So we'll talk more about this in future episodes when we get into building the hygiene department, but it's so critical. It's so important to your practice. And especially if you've got these inactive patients, they're so much easier to get back in than going after a new patient, which you should be doing anyway. So you need to get these people back. You can help them. They're your patients and they're your responsibility. And it helps them with their overall health. Anyway, so that's about all I have for this week. I hope this helps. I put links to everything I discussed in the description, the new patient workshop, the sales and communication seminars. And by the way, we do go over examples of how to reactivate a patient on our online platform, DDS Success. If you want to check that out, it's ddssuccess.com. I have the link in the description as well, and you can get a free demo. And otherwise, folks, that's about all I have. Thank you so much. I hope you guys do well, and I will see you next week.